Hi, let's see an NCLEX RN video based on shock. Shock is a life-threatening syndrome that occurs when the circulatory system is unable to supply adequate amount of oxygen to the tissues to meet the basic metabolic requirements. So this creates a state of tissue hypoxia later on, which will move to organ system failure and death may result. The first question, in a patient without a central line, which clinical finding does the nurse look to indicate effective response to treatment in the initial stage of shock? So the patient was in the initial stage of shock, then we had given some treatment and the patient had responded to that. So which findings show that the response is effective? Increased urine output, increased heart rate, decreased bowel sounds, decreased blood pressure. The answer is increased urine output. Increased urine output indicates the fluid volume status is normalizing. Tachycardia or increased heart rate indicates the body is still compensating for inadequate cardiac output. The decreased blood pressure and decreased bowel sounds indicate shock is continuing. Second question. After receiving the change of shift report, which of the following patients should the nurse assess first? 75-year-old client admitted after a myocardial infarction who is noted to be confused. 70-year-old type 2 diabetic client with a history of mitral valve prolapse who is scheduled to receive IV antibiotics. 60-year-old woman with a pacemaker who has a heart rate of 64 beats per minute and is requesting assistance to the bathroom. Fourth one, 45-year-old woman scheduled for a thallium scan who is receiving warfarin for atrial fibrillation. So here if we see the patients, the first one, see the 75-year-old client admitted after a myocardial infarction and is noted to be having confusion. So confusion in a patient with MI, it may be the first indicator of decreased cardiac output and the beginning of cardiogenic shock. So this is the first patient the nurse has to see. Secondly, the nurse has to move to the patient number 3, that is 60-year-old woman with a pacemaker who has a heart rate of 64 beats per minute and is requesting assistance to the bathroom. There is a risk for fall for this patient, so second the nurse has to see that. Third, the nurse has to give the antibiotics to the patient, so patient number 2 the nurse has to see, and the last the patient she will be seeing this the patient who will be going for a thallium scan. So there I talked about cardiogenic shock. So here you need to know about the different types of shock. Mainly the shock is classified into hypovolemic, cardiogenic, distributive and obstructive. Hypovolemic shock is because of external blood loss or internal bleeding, fluid loss secondary to severe vomiting, diarrhea, excessive urination or burns. There can be because of third space or transcellular fluid loss through pleural, peritoneal or joint spaces. So all this can result in hypovolemic shock. Cardiogenic shock can be after an MI, severe valvular dysfunction, severe heart failure. And distributive shock occurs after sepsis, anaphylaxis, brain injury, spinal injury or spinal anesthesia. And obstructive shock will result from tension, pneumothorax, cardiac tamponade and severe valvular disease. What is the third stage of shock? Is it the primary stage, progressive stage, tertiary stage or refractory stage? So here you need to know about the different stages of shock. The third stage, here it is asked, the third stage is progressive stage. Let's see the different stages of shock. Mainly there are four stages of shock. First is the initial stage, that is marked by hypoxia due to decreased oxygen delivery to the cells. Initial stage. Second stage is the compensatory stage, that is characterized by the initiation of compensatory mechanisms in an effort to maintain adequate volume, cardiac output and blood flow to the tissues. And the third stage is the progressive stage, which is marked by the failure of compensatory mechanism to maintain adequate blood pressure and circulating fluid volume. So there is extensive shunting of blood to the vital organs that result in decreased blood flow to the peripheries. So you can see worsening metabolic acidosis, electrolyte imbalance and respiratory acidosis in this third stage. And the last stage is the refractory stage. It is marked by prolonged inadequate blood supply to the cells that result in cell death and multiple organ system failure will occur. And if the shock is in the last stage or the refractory stage, it is irreversible. So this is what you need to know about the different stages of shock. Moving on to next question. What is one clinical manifestation of obstructive shock? Increased urine output, muffled heart tones, decreased appetite, hyperactive bowel sound. So here muffled heart sounds that indicate cardiac tamponade. So that is a manifestation of obstructive shock. Increased urine output doesn't happen in a shock. Urine output will be decreased and appetite will be decreased in any shock or any illness, and also the bowel sounds, they are not hyperactive, it becomes hypoactive. So here the answer is muffled heart tones, which may indicate cardiac tamponade. The 1-hour bundle of care in sepsis include which of the following? Select all that apply. Fluid resuscitation, obtain lactate levels, initiate broad spectrum antibiotics, obtain blood cultures, administer vasopressors if hypotension persists. In sepsis bundle of care, within 1 hour, you need to do certain action. One is you have to measure the lactate level. You have to reassess the lactate if it is showing more than 2 millimoles per liter. Then you need to obtain blood cultures before administering antibiotics. You need to take 2 blood cultures. Administer broad spectrum antibiotic. Administer 30 ml per kg of crystalloid if patient is hypotensive or you feel like or you have obtained the lactate level is 4 mg per deciliter. The lactate level, it is greater than 2 mg per deciliter, that means an abnormal value that indicates shock. And also administer vasopressors if blood pressure is unresponsive during or after fluid resuscitation. Mean arterial pressure you need to maintain at 65 mm of Hg or above. So here, seeing these options in the bundle, fluid resuscitation should be there, lactate level you should obtain, initiate broad spectrum antibiotics after doing the blood cultures, then administer vasopressors if hypertension persists. All options are correct. The nurse understands that dash increases as the delivery of oxygen to the tissue falls below the tissue's requirement. Select all that apply. VO2, oxygen depth, SVO2, partial pressure of oxygen and preload. Here VO2 is oxygen consumption and SpO2 is venous oxygen saturation. So when the question is dash increases as the delivery of oxygen to the tissues falls. Here the tissues are not getting enough oxygen, then that time oxygen consumption will be increased. VO2, that is oxygen consumption will be increased. The second one, oxygen depth. Oxygen depth means it is the difference between the normal oxygen consumption and during the low oxygen delivery. So at that time also the difference will be more. So oxygen depth also will be more. So these are the two things which will be increased when the tissue oxygen falls, and preload will be decreased because of inadequate oxygen delivery. The nurse understands which patient is at risk for developing hypovolemic shock. A patient with severe valvular disease, a patient receiving spinal anesthesia, patient with severe diarrhea, patient with a large pneumothorax. Here the question is asking hypovolemic shock. Hypovolemic shock is because the fluid is less. So here the patient with severe diarrhea is at risk for developing hypovolemic shock. Then if you see valvular disease, they will be having a chance of obstructive shock. In the previous one slide we have seen what are the different types of shock. So you just see that slide again. The patient receiving spinal anesthesia is at a risk of developing a neurogenic shock, and a patient with a large pneumothorax is at a chance of developing an obstructive shock. The nurse monitors for which clinical manifestation in a patient in compensatory shock: low but normal blood pressure oliguria, cold extremities and hyperglycemia, weak pulses hypoventilation, hypotension tachycardia. So here the patient is in compensatory shock. Compensatory shock, the patient may be having restlessness, confusion, increased heart rate, tachypnea, respiratory alkalosis, oliguria, hyperglycemia, decreased bowel sounds, weak pulses, and cool and moist skin. Compensatory mechanisms temporarily maintain a normal BP also. So the answer here is low but normal BP and oliguria can be seen in patient in compensatory shock. This cold extremities, then hypotension, they are associated with progressive shock. The nurse understands that the following are the best parameter for evaluating the severity of the shock state. Select all that apply. SvO2, that is the oxygen, venous oxygen saturation. Then lactate level, base excess, glucose level, partial pressure of oxygen. So SvO2 is a reflection of oxygen consumption at the tissue level, that is venous oxygen saturation. So SvO2 is a good indicator to know the severity of the shock. Then the second one is lactate and base excess. They too estimate the extent of acidosis at the tissue level, lactate level and base excess. So evidence has already shown that all these three, SvO2, lactate level and base excess, they are good indicators of the severity of shock. Systemic vascular resistance is either up or down depending upon the type of shock or compensation. The glucose levels may elevate as a part of compensatory process, but it doesn't directly reflect the severity. So glucose level is not the good indicator. And also the changes in partial pressure of oxygen, that also reflect the severity of pulmonary disease, not a shock. So the first three are the main indicators that show the severity of shock. The nurse understands the following are clinical manifestations of neurogenic shock. Select all that apply. Tachycardia, vasoconstriction, tachypnea, decreased central venous pressure, and bradycardia. Neurogenic shock is caused by vasodilation resulting in decreased venous return and filling pressures. Due to the loss of sympathetic response, bradycardia occurs. And also there is the respiratory rate may be low due to the injury that is causing neurogenic shock, such as the cervical spinal cord injury. So you can't see tachypnea, the respiratory rate is low, that is bradypnea you can see. And another thing is decreased central venous pressure, because that is a neurogenic shock. And also bradycardia, the heart rate also will be less or lower because of the sympathetic response. An older adult patient was admitted to the hospital 1 hour ago with a urinary tract infection, fever, tachycardia, hypotension, and confusion. The nurse anticipates which of the following interventions: assess fluid status, insert arterial line, insert central venous line, initiate a vasoactive drip, obtain lactate level and blood cultures, obtain blood and urine cultures, initiate broad spectrum antibiotics, fluid resuscitation, assess fluid status, obtain lactate level, insert central venous catheter. So here the nurse has to obtain blood and urine culture, initiate broad spectrum antibiotic and fluid resuscitation. This is the action which is recommended within 1 hour of identifying a sepsis or septic shock. So first you need to measure lactate level, obtain blood culture prior to administering antibiotic, administer broad spectrum antibiotic, begin fluid resuscitation, administer vasopressors if the patient remains hypotensive. These guidelines do not include the insertion of an arterial line or a central venous line, but acknowledge they are strategies to be used to assess the responsiveness to therapy. So here the first one, arterial line or central venous line, that is not required. And before doing this blood culture, after doing this blood culture, you need to initiate broad spectrum antibiotics and fluid resuscitation. That is very important. And for this patient, but this particular patient, urine cultures are included because the patient has got urinary tract infection. Then vasoactive drips would only be started if the patient remained hypotensive after fluid resuscitation was begun. So the second point is omitted in that way. Then fluid status will be reassessed after therapy was begin. So this fluid status should be reassessed after the therapy begins. The nurse understands the following indicates the initial phase of disseminated intravascular coagulation: bleeding from all puncture sites, cold motile extremities, increased antithrombin 3 levels, increased fibrin degradation products. So disseminated intravascular coagulation and multiple organ dysfunction syndrome, these two are the major complications of septic shock. So when the clinical manifestations which are shown in the initial phase of DIC are characterized by enhanced clotting. So obstruction of flow of blood is there, that cause cold and mottled extremities. So the answer is cold and mottled extremities. One reason for this enhanced clotting is decreased antithrombin 3 levels. It is not increased, it is decreased antithrombin 3 levels. The second phase of DIC is characterized by excessive bleeding due to clot breakdown that result in increased fibrin degradation products. So here the first phase of DIC is seen with cold and mottled extremity. The nurse monitors for which clinical manifestation in the early stage of septic shock? Decreased cardiac output, increased systemic vascular resistance, increased PA wedge pressure, increased cardiac output. So here, early stage of septic shock due to the vasodilation and tachycardia associated with early sepsis, it is characterized by increased cardiac output, low filling pressures and low systemic vascular resistance is seen, not increased one. Okay. It's a priority for nurse to follow up with the provider about which order in septic shock patient. So certain orders doctor has written, the nurse has to question which order. Start antibiotics after blood culture obtained. Prepare a norepinephrine drip. Hourly vital signs. Send one set blood culture. So here we need to question sending one set blood culture. Two sets of blood cultures from two different sites. They are recommended to accurately identify the offending organism before starting antibiotics. Antibiotics are indicated in sepsis. Norepinephrine may be indicated if patient's BP doesn't improve even if we give the fluid resuscitation, and vital signs should be obtained at least hourly to monitor the condition and response to treatment. So here you need to question the one set of blood culture. Nurse evaluates which parameter as an indication of adequacy of treatment in shock. Is it a central venous pressure? Is it a PAOP, pulmonary artery occlusive pressure? Is it saturation of oxygen, SpO2, or SvO2? SvO2 is venous oxygen saturation. So, as an important indicator of the shock, we need to assess the ABG analysis, then SvO2, that is venous oxygen saturation or central venous oxygen saturation we will be seeing, then base deficit and lactate level we will be obtaining. Here base deficit and lactate level it is not shown, ABG analysis is not shown. Here the only option which is shown is SvO2, that is the saturation, the venous saturation of oxygen. Nurse understand which laboratory result indicates shock condition is improving. Select all that apply. Increasing lactate level, decreasing base excess level, increasing saturation, central venous saturation of oxygen level, decreasing lactate level, increasing blood urea nitrogen and creatinine. Here, if the lactate level is increasing, that is abnormal. So lactate level should be decreasing lactate level, and above the base excess also should be decreasing. The next one is the venous saturation or the central venous oxygen saturation should be increasing. It should be above 60%. So these are the three things mainly we will be seeing in the laboratory findings. One is base deficit, next is venous oxygen saturation, then it is the lactate. Increasing BUN, blood urea nitrogen and creatinine, that indicates there is a problem with the renal function. So hope you understood this NCLEX RN video on shock. Thank you so much. Please do subscribe.